Hello everybody, this is Beth Deporte-Smith, Master Clinical Injector here at de+fine Medical Aesthetics. Today we're going to be doing a little assessment on our beautiful patient here. During our consult, she spoke about the fact that she was unhappy about the presence of her nasolabial folds, which is this line that kind of stems from the corners of the mouth to the downturned part of the mouth. She felt that she had maybe a little bit of flat affect or appearance in the middle part of her face. So this is a very common area of concern or area of opportunity for my patients that we talk about. And oftentimes the reason why we feel that we have a little bit more presence of a nasolabial fold is because we tend to lose volume in the cheeks. Now, let me stop and tell you, when I say cheeks, it doesn't mean that you're gonna have bigger, fuller chipmunk cheeks. If the product is injected in the right place and it's done appropriately, you will actually have more angulation, more contour, more lifting, and actually appear about 10 pounds thinner when we do the cheeks. So it's a win-win for everybody, okay? I'm gonna talk to you a little bit about why and how the process of aging happens and why we're gonna go for injecting the cheeks versus kind of treating just the nasolabial fold, okay? So when babies are born, they have nice big supple cheeks that you wanna bite, kiss, and chew, right? And happy 29th birthday, friend, because that's when we start the aging process. As you can see here, this is kind of a visual depiction of the aging process. This is 35, 45, and 55, okay? What I want you to focus on is this middle part, this yellow part of the cheek. That's called the medial malar fat pad. As you can see, in our 30s and getting middle 35s, we're starting to have a little bit more robust cheek, but then over time, it's starting to disseminate. Kind of a common little joke that I share is, as we get older, we want to retire down south, well, so do our jowls. So if we lose the structure in the middle part of our face, that's gonna cause this presence of this nasolabial fold, okay? So when we look in the mirror, I wanna show you what it would look like if I take this little cotton tip applicator and put a little bit of volume in the cheek. See how that lifts up that nasolabial fold, provides some structure and this little bit of flatness. See how you have a little line of deficit here? So if we put a little bit of volume in through there, and inject all along the lateral, medial lateral aspect of the cheek, you're gonna get a nice lift. Again, it's going to lift everything. It'll even benefit the corners of our mouth, even sometimes these lines called here the marionette lines. So by just doing a little cheek injections, and it typically takes 1 syringe per cheek. So when we're treating this area, there are a couple different products that I personally prefer. There's a product called Radiesse, which is calcium hydroxyapatite. It adheres to the bone and stimulates your own body's collagen. Lasts about 12 to 18 months. There's another product called Restylane Lift. It's a hyaluronic acid, which is a natural sugar-based substance. That lasts typically about 9 to 12 months. So if we're looking to give a little bit more structure and a little bit more definition to our cheeks without having excessive volume or any volume whatsoever, over volume, just to have a nice contour, these are the appropriate products for you. So I think we should proceed today with doing cheeks. What do you think?
I think so.